When I was asked to speak, I don't remember if it was Earl or Mike that said I was coming to represent the entire federal government. That is not true. However, I am here to speak as the Chief Dental Officer for the Centers for Medicare and Medicaid Services. It was about my second day on the job back in 2012 when I met with Cindy Mann, who was then the director of the Center for Medicaid and CHIP Services. She says, "What are your goals?" Well, I was brand new. I'd barely found the bathroom. And I said, well, first goal is to make sure that every child on Medicaid gets the appropriate dental services that they should have. And secondly, we need a dental benefit in Medicare. And it frankly kind of took her back a little bit because she wasn't expecting that. Oral health is incredibly important to CMS, but I know that you've seen that most of our efforts have been directed at children, especially those on Medicaid and CHIP. But that does not mean that we're not interested in adults and elders as well. I'd been on the job about 6 months when I did my first congressional briefing, and I told him, I said, I don't mean to be flippant, but apparently in this country, when somebody reaches age 65, we no longer care about their oral health. And I was amazed at the number of people, even in that audience, that didn't realize that there was no dental benefit in Medicare. As I'm sure you are aware, Section 1862 of the Social Security Act excludes dental services from Medicare, and it specifically says treatment and care or replacement of teeth and their supporting structures. Well, what it's given us the opportunity to do then is to create awareness about this lack of a dental benefit, and working together internally within CMS and externally with so many of the partners in this room, it's given us a chance to really move this conversation forward. I think there are three ways that we can attack the problem. First of all, we've had conversations about medically necessary dental care, and there is precedent within the Medicare program that that is a step that could be taken without congressional action. And special thanks to the Center for Medicare Advocacy for moving that forward. Another thing we're working on is through the Center for Medicare and Medicaid Innovation, typically called the Innovation Center, the folks with the biggest bucks at CMS, and charged with finding innovative ways to provide health care. Now, I've been really lucky. I think we've had like 6 different dental and oral health visits with the leadership in CMMI, and I think that's a great step forward. And the reason that we need the Innovation Center involved, as Mike alluded to earlier, is we need the demonstration projects that could be funded by the Innovation Center that will help us convince Congress that maybe there's action that they need to take. And a special thanks to Congress. We are going back to work on Monday. We're not shutting down tomorrow. So it's through all 3 of these things, working through medically necessary dental care, the Innovation Center, and hopefully making the case with Congress as time goes on that we can truly make a difference. So it's been a great opportunity working with the Santa Fe group and all of the partners in planning this meeting. And I just want to thank each and every one of you for being here today to help move this conversation forward. Thank you very much.